This and more on this Monday's edition of Panorama. Thanks for joining us. I'm Ian Ray John. We'll begin Panorama on a sad note as Nigeria records its first death from COVID-19. Report just reaching us says a former managing director of the Petroleum Products Marketing Company of Nigeria, a subsidiary of the NNPC, 67-year-old Suleiman Achimugu has died of coronavirus in the early hours of Monday. The late Achimugu had visited the United Kingdom where he has gone for medical treatment, arrived in Nigeria 2 weeks ago and had been in self-isolation before his transfer to the University of Abuja Teaching Hospital following presentation of symptoms and subsequent confirmation of COVID-19. Officials of the Nigeria Center for Disease Control says that the family of the deceased is currently quarantined. And still on coronavirus, the coronavirus since its debut in Nigeria, February, has risen from just the index case to 36 cases as at March 23, 2020, with 20 patients already discharged. Lagos tops the chart in cases with 22 diagnoses, followed by FCT with 4 cases and Ogun State with 2 cases. Oyo, Edo and Ekiti states have 1 case each. Lagos State Governor Babajide Sanwo-Olu has directed all civil servants on grade level 1 to 12 to remain at home for the next 14 days as part of precautionary measures to curb the spread of the coronavirus disease. The governor gave the order while updating the media on the status of the virus in the state. Nusa Usula reports that the governor confirmed that a total of 22 cases of the virus in the state.
The directive of the governor, which will last for 14 days, at the first instance affects 70% of the entire state civil service. Governor Sanwo-Olu stated that the directive does not affect those on essential services and emergencies, which include safety agencies and emergency first responders. The governor added that the state government had taken proactive measures due to the threat of the virus, urging residents to practice high level of personal hygiene as they cooperate with his administration to address and curtail the spread of COVID-19 in the state.
This is not the time for fake news and unverified news, especially on the social media. Let me also appeal to the media community in its entirety to support the battle by helping amplify these various guidelines and advice of all the contact numbers that were set out.
The governor assured residents that well-equipped isolation centers have been set up in all 5 divisions of the state.
14 days at the minimum, self-isolate yourself if you have just come back from an international travel.
Sanwo-Olu explained that the state government is working on how to cushion and address the economic effects of the pandemic on residents, especially the less privileged in the state. In Lagos, Nusa Usula, NTA News.
Meanwhile, the Federal Capital Territory has recorded 1 new case of COVID-19 in addition to the 3 cases earlier reported on Saturday, March 21, 2020, bringing the total number to 4. The Acting Secretary, FCT Health and Human Service Secretariat, Dr. Kawu Mohammed, disclosed that the patient has been swiftly moved to the University of Abuja Teaching Hospital, Gwagwalada, for proper management. Hakimat Aliyu brings us details.
The new confirmed case of COVID-19 in the Federal Capital Territory, Abuja, is a man in his 40s who has recently traveled to the United Kingdom.
The family invited us that somebody has similar symptoms of cough, sneezing, upper respiratory infection, some difficulty in breathing. So we sent our team earlier, who now took samples, and the sample came positive.
He also noted that 39 cases were reported and tested in the FCT, while 4 were confirmed to be positive and others pending. To ascertain the condition of the new case and the earlier reported 3 cases, the crew proceeded to the University of Abuja Teaching Hospital, Gwagwalada. Behind me is the isolation center at the University of Abuja Teaching Hospital, Gwagwalada, where the 4 confirmed cases of COVID-19 are currently being managed. All efforts to speak to the specialists proved abortive as they are busy attending to the patients. Meanwhile, the inaugurated FCT emergency response team with different committees for contact tracing, testing and monitoring says they are working assiduously to ensure no effort is spared in containing the spread of the dreaded coronavirus disease. In Abuja, Hakimat Aliu, NTA News.
And in Katsina State, the Daura Emirate has suspended Islamia and Quranic school sessions across the Emirate. Emir of Daura, Alhaji Umar Farouk Umar, announced the decision following a prayer session held on coronavirus in his palace. Correspondent Shehu Adamu has more on the report.
The prayer session, which had in attendance all the district heads, village and ward heads, as well as imams within the Daura Emirate, seeks for God's intervention against the spread of coronavirus pandemic. Emir of Daura Umar Farouk Umar directed the immediate closure of all Quranic and Islamia schools within the Emirate as part of measures to protecting his subjects from COVID-19. The Emir therefore called on his subjects to always practice personal and environmental hygiene as preventive measures against the pandemic. Special Assistant to the Emir of Daura, Ibrahim Hamis, will shed more light on the Emir's directive.
The Emir actually told all these people he gathered in his palace is how to avoid or how to protect ourselves from the scourge of COVID-19.
Some of the Islamic scholars at the prayer session, including Imam Abdulaziz Abubakar Sabon Kwari and Amina Abubakar, justified the Emir's directive, quoting relevant verses and teachings of Prophet Muhammad, where Muslims are requested to take necessary measures to guard against the spread of any pandemic. In Katsina, Shehu Adamu, NTA News.
Time to take a break on Panorama. The news continues shortly.
The struggle for independence had been a long and tough one. Our founding fathers and compatriots sacrificed their comfort and even shed their blood. We cannot at this point in history afford to spirit away their sacrifices for immediate but temporary gains of today. Let us emphasize what unites and not what divides us. Working for the unity of purpose with a stronger vision for a better tomorrow. NTA, growing with the nation.
Together, no matter where you come from, no matter your religion, we are one. Let's live together. Let's stop fighting each other. Let us live as one. It doesn't matter where you come from, your tribe or religion, man, woman or child. It doesn't matter who you are. Put Nigeria first. No matter where you come from, no matter your religion, we are one. Let's live together. How can we develop when we're always in crisis? Families have become refugees in their country. No matter our differences, show some understanding. No matter where you come from, no matter your religion, we are one. Let's live together.
Nigeria, the only country we can train with remarkable potentials to excel. Let us believe in ourselves and change our attitude for the sake of our country and generations unborn. Let us revive our cultural values, which are our essence as a nation. Let us renew the spirit of patriotism and hope in our dear country. Do not take or give bribe. Be punctual always. No more African time. We can't expect to be global citizens and operate on African time. Join the queue. Insist that people are attended to on a first-come basis, no matter who they are or where they come from.
Nigeria, good people, great nation.
Welcome back. I have with me in the studio Dr. Jerry the First Oguzie. He's a public health physician and he's here to talk to us more on COVID-19. Many thanks for joining us, sir.
Thank you very much for having me here.
Okay, now, could you tell Nigerians about COVID-19 in view of more confirmed cases? And the moment stands at 36 in Nigeria and, of course, recording the first death today.
Well, once in a while we have such diseases that come from viruses, and COVID-19 is just one of them. It's, of course, all of us know where it came from, Wuhan in China, sometime in December last year. But they could actually report it on December 1st when it happened first time. It was about December 31st, and I told the WHO about the outbreak of this disease. It's a viral infection. It's supposed to be self-limiting, ordinarily, like the flu we get, the flu, influenza and stuff. It's supposed to be self-limiting. But COVID has gone beyond what we think it's supposed to be. And that is why there's a panic. And many people are bringing out so many theories about COVID-19. The important thing to note, which is what I want to say here, is that it is not a death sentence. That one has tested positive to COVID-19 is not a death sentence. It is still something that is manageable. And that is why we advise people that as soon as anybody feels that he has tested positive, the next thing to do is to either quarantine or do self-isolation for at least 14 days. Because the virus lasts in the system, before it begins to show signs and symptoms, about 14 days. So if after 14 days the person doesn't come down with cold, fever, cough and all that, then that means the person has not contracted the disease.
Okay, so now you said it's not a death sentence.
Yes.
Experts have also said in the past that it is not airborne. But we're beginning to hear something different.
Yes, that's actually what has surprised all of us. Before now we were saying that it is not a droplet infection, it's not airborne. But now, in the past week, because of deaths that have occurred, because of autopsies that have been carried out by pathologists and all that, we have discovered that it is now airborne. And it can last as long as 8 to 9 hours in the air. That means anywhere it is prevalent, then people all over the place should be wearing face masks, whether you're infected or not infected.
So that actually answers my next question. So it means that we should go about with our face mask.
Yes. In Abuja, in Lagos, anybody in Abuja, in Lagos, particularly in areas of isolation, should be on face mask 24/7, if possible. Unless the person is in his house. Because in the house, of course, if everything is done well, there shouldn't be any virus in the house. But outside the house, it is important that people go about with face mask. Of course, the other ones of not shaking hands, it is still transmitted person to person.
Okay.
So, not shaking hands, not hugging, not kissing, except for partners, keeping social distance in the gatherings are still very much in vogue.
With this latest update of it being airborne, I must say that I'm a little bit thrown off balance even here right now, talking with you. I hope I'm safe.
I was also thinking I hope I'm safe in the studio, because I do not know where you have been. You don't know where I have been. And that's what I also advise people who have travel history to, when they come back from wherever they've gone to, before you enter your house, sanitize yourself. What I have done in my house is I've put a jar of water right out there and soap, washing soap. Anywhere you're coming from, first of all, wash your hands before entering the house. Then as soon as you get to the place, remove your clothes, put them in the sink for washing. Go take your bath before you go into any other place.
What about babies, please?
That's the challenge also for children, for babies, because this virus is very virulent in babies and the elderly, particularly the elderly with other diseases like cancer, diabetes, hypertension. It is prevalent in them. So, and very virulent too. So for babies, we advise the mothers to keep their babies as clean as they can. Whatever you do for yourself, please do for your baby, including the face mask if you're moving out with the baby. If the baby can stay in the house, better. But if the baby is still too small, 2-3 months, it can't stay in the house, protect her or him from catching the virus.
Okay, as a member of the Nigerian Medical Association, what will be your advice to government and to citizens at this point?
Well, the government, the NMA, the president of NMA has actually spoken on COVID-19 and what we expect government to have done. Because when we had that index case of Italian who came into Nigeria, that would have been the time to actually close the borders, in quotes. Stop air transport between us and all these Latin countries that have stopped. Would have been done then. But it's not, doing it last week, it's like we have taken a shine off ourselves. Ordinarily, what have done it that time? Now we have 36 cases. Then we had only him. But now 36. We have had recorded 1 death. There are 3 people, at least in Gwagwala, that I know who are in quarantine now.
This is what could have been done. What do we do
So what we're supposed to be doing now is to build more isolation centers.
Okay.
If we're not building, then let's refurbish centers that we can use. Because that's one they showed us somewhere in Benin or so, that is decrepit and nobody can actually live there and survive. In fact, the patient died there, according to information we got. So if we cannot build new centers, isolation centers, let's refurbish and renovate the ones we have available and use them for people, because we're just in the middle of it. The next 30 days will determine whether Nigeria is going the way of China or going the way of Italy or going the way of South Korea or any of those other countries. So between now and then, let's government put everything in place to be able to, and then let them also help us, the doctors and the other health workers. Because you come to the hospital, we don't have the testing kits are not there. People are not protected. These personal protective equipment we are supposed to be using, they're not there. So we're still moving around, carrying face masks, carrying gloves and all that. That's not actually very protective, even though it is somehow protective. But government can afford to supply us with those items that we need to protect ourselves and protect the patient too, who is consulting us.
Well, thank you so much, Dr. Jerry the First Oguzie. It's been very educative listening to you.
Thank you.
All right, still on COVID-19, the Inspector General of Police, Mohammed Abubakar Adamu, has directed all zonal assistant inspectors general of police and commissioners of police nationwide to ensure that all legitimate orders given in pursuant to the containment efforts are strictly enforced within their areas of jurisdiction. In a statement by the Force Public Relations Officer, Frank Mba, the IGP urged officers to observe personal safety measures and also directed the zonal AIGs and command CPs to ensure that cases of unnecessary arrest and detention of suspects are not condoned. He reiterated that detention of suspects must be reduced to the barest minimum and that only very serious cases such as terrorism, armed robbery, homicide and other non-billable offences should warrant detention. The IGP also directed that adequate measures be put in place to screen persons to be committed into police custody. The IGP enjoined citizens to avoid social visits to police stations and other police offices and minimize official visits, except where necessary. The IGP has also ordered the immediate closure of the Nigeria Police Academy as well as all police primary and secondary schools nationwide. Meanwhile, the Force Medical Services has been empowered and directed to step up sensitization programs. The International Press Center, Nigeria, has called on media proprietors to provide necessary protective gadgets and medications for journalists covering the COVID-19 pandemic in Nigeria. In a message, the IPC said journalists as professionals on essential duties should be given high priority in terms of safety. The IPC wants journalists to be provided with adequate protective wears, hand sanitizers, and, if possible, placed on a special insurance package. IPC also advised journalists to adhere to all the health tips to avoid COVID-19 infection as outlined by global health bodies and national health institutions, while exercising professionalism and ensure facts are checked to mitigate the spread of false or misleading information. And still on COVID-19, as COVID-19 continues to rampage, Primate of the Church of Nigeria, Anglican Communion, advocates greater attention of rural areas to avoid an escalation. The Primate, Most Reverend Nicholas Oko, gave the advice in Abuja at a service to commemorate his retirement. Victor Azu reports.
It is an uncharacteristically scanty service at the Cathedral Church of the Advent. Worse still, it is the last for Nicholas Oko as Primate of the Church of Nigeria. But desperate times call for desperate measures. This service is restricted in compliance with the advice of health authorities and the FCTA. Notwithstanding, the need for thanksgiving is not lost on Primate Oko after a successful 10-year tenure. Afterwards, he weighs in on the coronavirus pandemic, calling for more support for rural areas.
While the government is doing everything in the urban centers to monitor what's going on, efforts should be made by the Ministry of Health to ensure that the rural areas are well policed and looked after to avoid an outbreak in the rural areas.
The countdown begins to Wednesday when a new primate will be inaugurated. In Abuja, Victor Azu, NTA News.
In the meantime, Buhari Media Organization says those calling for the president to address the nation on the COVID-19 pandemic should consider the worth of a television address against getting the country prepared for the fallout of the pandemic. The media organization in a statement cautions that getting the country prepared to prevent the spread of the pandemic in the country should take priority over presidential address. The group says that strengthening Nigeria's institutions and taking the necessary steps to bolster the country's preparedness socially and economically should take priority, and adds that President Buhari's administration has taken critical steps to ensure it contains the spread and prevents entry of the pandemic into the country. The administration, the statement adds, has also put in place the necessary cautions to prevent any shocks to the economy, especially given the drop in global crude oil prices. The group explained further that while it was good to address the nation to boost spirits, it is perhaps not the best move to make so as not to feed any feelings of panic that something dreadful is underway. In other news, just a few days back, the Lagos State government pronounced a ban on any public gathering exceeding 50 persons. The figure has further reduced to 20. What is the level of adherence, especially by churches, this first Sunday after the implementation of the ban? Adiola Kami Akere went round and brought back this report.
Available statistics indicate that the coronavirus death rate is on the increase globally, while it shows that the older generation are worse hit. Therefore, more attention is now on preventive and precautionary measures to reduce the spread of the virus. We decided to go around some churches in the Lagos metropolis to find out how they were able to take care of their parishioners or their members. I am now at the Holy Cross Cathedral in Lagos. Reverend Father Marcelinus Teko, the administrator of the church, and he will be letting us know how the service went this Sunday.
The Archbishop, Most Reverend Dr. Alfred Adewale Martins, issued a directive that all public masses should be suspended for now. So in all Catholic churches today, no public masses were celebrated.
How was the adherence by the Anglican faithful?
The church authority also directed us that we should comply with the rules.
From the foregoing, it therefore shows that Lagosians are desirous to see that this novel coronavirus pandemic comes to an end for life to return to normal for this ever-busy metropolitan city. In Lagos, Adeola Kami Akere, NTA News.
The federal government has called on all political actors and other stakeholders in the Republic of Guinea to refrain from violence and commit to an inclusive, transparent, free, fair and peaceful election to consolidate peace and stability in the country. A statement by the spokesman of the Nigerian Foreign Affairs Ministry, Ferdinand Moye, says Nigeria has observed with keen interest recent political developments in the Republic of Guinea and believes that West Africa, despite some security challenges, has made a great deal of progress in consolidating the democratic gains in the sub-region. The federal government of Nigeria appeals to the people of Guinea to provide required enabling environment for democracy to strive through the resolution of all internal challenges. And on sports, 3 persons died on Sunday in a car accident in Abuja along Agbo-Benin Highway. 2 were Rangers players, Ifeanyi George and Emmanuel Ugu, while the third occupant, Eteka Gabriel, was a friend accompanying George. Amanzi Marcos reports.
As the coronavirus pandemic takes its toll